What if your thyroid is the problem, even though your healthcare provider says it's normal? If your TSH came back in range, but you're still feeling exhausted, you're losing hair, gaining weight, and feeling brain foggy, then these are symptoms of low thyroid and you may need further testing. A TSH alone doesn't always tell you the whole story about what's going on with your thyroid. So stay tuned to find out what's missing and what labs that you need to ask for at your next appointment to fully evaluate your thyroid. Hi, I'm Dr. Var. I'm a board certified family medicine physician, and I help people reset their health and reclaim their life by bringing together conventional medicine with functional, integrative, and lifestyle medicine, thus providing better medicine. Here's what people don't realize. The standard thyroid test, a TSH, is just a screening tool, and it basically is telling us how your brain is affecting your thyroid. But you see, you have thyroid receptors that are expressed in nearly all tissues in the body, which is why thyroid hormone has such widespread effects if it is off. It can affect your energy, your mood, your weight, your heart rate, even your gut motility, and more. So let's break down exactly why a TSH alone doesn't tell the whole story. So how does the thyroid gland know to make your thyroid hormones? Well, it gets signals from the brain. There's an area of your brain called the hypothalamus, which can make something called TRH when it senses that there's less thyroid hormone around. TRH then goes to the pituitary gland in your brain. The TRH will tell the pituitary gland to make TSH, and TSH then tells your thyroid you need to produce your thyroid hormones. And there's two thyroid hormones. There's T4 and there's T3. Now, T4 is an inactive form of your thyroid hormone. In order for it to be active, it has to get converted to T3. And your thyroid gland produces some T3 on its own, but the rest of your T3, about 80% of it that's floating around in your body, is made because it gets converted from T4. Now, once these thyroid hormones are made, both T3 and T4 will then tell the pituitary gland, hey, there's enough thyroid hormone so you can stop making TSH. So it just puts a hold on things until it gets a signal that it needs more. So some people get very confused because they think the TSH is actually from the thyroid. And so if it's low, it means you don't have enough thyroid hormone. And if it's high, it means you have too much thyroid hormone. But because it is made from the pituitary gland, a higher TSH can actually mean that you don't have enough thyroid hormones because it's your pituitary gland making more and more to trigger your thyroid gland to make thyroid hormones. Once there's enough, those thyroid hormones then tell the pituitary gland to stop making TSH. And if you have an excessive thyroid amount of hormone, then those thyroid hormones are going to really lower your TSH. So a low TSH means that you're making too much. A TSH is a good screening tool if it's abnormal, because then you know there's definitely a problem. But there are a lot of people that fall in range because TSH has such a wide range of normality. It goes from 0.5 to 5. They have done studies that have shown that many people actually do better when their TSH is between 0.5 and 2.5. As you get older, your TSH can be a little higher. But they did also find studies that the higher your TSH, then the more likely you may actually have cardiovascular problems. One thing that can happen is there can be an issue with your conversion from T4 to T3. So you can have plenty of T4 around that is feeding back to the pituitary gland, telling your pituitary gland that things are okay because it sees that there's T4 and it assumes that it's going to get converted to T3. But there are things that can affect that conversion. Number one is stress. When you're highly stressed and you're making more cortisol, then that cortisol will downregulate the enzyme that converts T4 to T3. So you don't have enough T3, which, as I mentioned earlier, is your active thyroid hormone. And if you just have T4, that's not going to really do anything as far as your thyroid being able to affect all the tissues that it affects. So then you get those symptoms. Now, T4, if it's not getting converted to T3, it'll actually convert to something called RT3. And RT3 is inactive. So one of the ways that you can evaluate your thyroid is to see how much of your T3 to T4 you have. So T3 in the blood, unfortunately, isn't always accurate, which is probably why a lot of endocrinologists and primary care doctors don't want to order it. From a functional medicine standpoint, if you look at the ratio, that can also tell you something. Your T3 to T4 ratio should be ideally around 0.33 or higher. Now, you do have to convert it by units, so don't just take your free T3 divided by your free T4 and think you have the correct ratio. They are usually reported in different units. There are some labs that do a more accurate free T3 by LCMS technique, and that is more accurate. But I primarily use Quest Lab, and as far as I know, they don't have it, or at least it's not in our electronic medical record system. So you want to make sure you're getting the right free T3, but if your lab doesn't have it, you can have your healthcare provider see what the ratio is, but make sure that they convert it to units. If your ratio is lower, then that may indicate that you're not converting well. Other things that can affect this conversion are zinc and selenium. Zinc and selenium are needed for the enzyme to convert T4 to T3. One simple sign that you can see for low zinc is if you have little white spots on your fingernails. So that's one sign. You may still have a zinc deficiency and not have that sign, but if you do, then it's possible. And then you may have trouble with conversion. And so you don't have as much of the active T3 hormone around. Now, I have seen some of the endocrinologists actually recommend selenium to take as a supplement if you have thyroid problems. Selenium may help if you have thyroid issues because it helps the conversion if that's a problem. I always recommend zinc-rich foods and selenium-rich foods for people to take. Pumpkin seeds are a great source of zinc. And Brazil nuts are a great source of selenium, but you don't want to get too much. I usually recommend 1 to 2 Brazil nuts every couple of days. The other thing I will order is an RT3. T4, if it doesn't get converted to T3, it'll get converted to RT3, and RT3 is inactive. So if I see a very high RT3 and a normal free T4 and T3, I might wonder if there's a conversion issue, because the other thing is T3 is sometimes hard to measure in the blood. And this is part of the reason why conventional doctors and endocrinologists may not order it, because it's not always accurate. So it may not necessarily tell them anything, because there can be some false highs or false lows with it. But I order it to get a baseline. If your RT3 is on the high end, then you know that a lot of your T4 is getting converted to RT3. And some providers will even look at the ratio of T3 to RT3 as a way to also determine if you're getting enough conversion. Now, if I had just checked a TSH on you and you were having symptoms and it looked like it was normal, like, if it was 2.59, for example, if I didn't have the functional integrative training, I might think that your thyroid is fine, when in actuality, there may be a conversion problem. Now, you do have to adjust the units because they're not reported in the same unit. So don't just take your free T3 and divide it by your free T4 because it won't be correct. You have to convert it to the right units. And typically, if it's under 0.33, then you may not be converting well. You also can look at your T3 to RT3 ratio as well. Again, you have to convert it to units. And in general, as long as it's above 20, then you're converting well. The other thing I also want to say is that RT3 can also affect the signaling of your receptors. And when you are stressed, you tend to make more RT3. So if you are stressed, I wouldn't just rely on a TSH alone. I would ask your provider to check a more expanded panel. If they're open to it, they will. But, of course, there are a lot that won't do it, mainly because they don't know what to do with the results. Even when I first started, sometimes I didn't want to order stuff because I didn't know what to do about it. And we didn't have all the resources 20 years ago to really delve into it. So sometimes that's a lot of the barrier for your provider wanting to order a test, because they're thinking, well, what am I going to do with this information? Is it going to change any treatment? One thing you could do is when you do ask your doctor for these tests, bring them some resources that they can quickly read. And sometimes that will get you what you need, because then they can understand why you want these other tests. But if they don't know, they're just going to flat out say no. Now, if you don't have a lot of symptoms, a TSH may be fine to determine if you need to delve further or not. So if you have a family history and, maybe you have one symptom where you're gaining some weight and your doctor might check it and it's fine, and you can account for other reasons for the weight gain, then, you know, you may not need all those additional tests if you don't have a lot of symptoms. But typically, if my patients, if I see that their TSH is above 2 and they have, a couple of different thyroid symptoms, I will check the more expanded panel. Sometimes it is off and sometimes it's not, and we go looking elsewhere, but at least we can rule that out. The other tests that I check are thyroid antibodies. If I suspect hypothyroidism, which is a majority of people, more people have hypo, which means you don't make enough, versus hyper. And hyperthyroidism is a different kind of breed. If you want, I can do a video on hyperthyroidism. Just leave a note in the comments. This video is just basically talking about hypothyroidism. If your conversion is off, it doesn't necessarily mean that you need thyroid medicine, but you may need to have better stress management. You might need to eat zinc-rich foods or take a supplement for either one of those. So it's not even just to determine if you need medicine. Some people, if they think they have a thyroid issue, they feel so bad that they think that medication is the only answer. But I'm like, wait, let's manage your stress. Let's try to see if there's vitamin deficiencies. And that's the other thing that I will cover when I do the lab video is there are a lot of other vitamins and minerals that play a role in how your thyroid functions. So if you have any certain vitamin deficiencies, you might be at risk for thyroid. But anyways, I kind of digress. So I usually will also check antibodies because a lot of people will have Hashimoto's, which is the autoimmune form of hypothyroidism. When you have that, your thyroid might be inflamed before you actually see it in the blood work. So you may even start having some symptoms, and then it varies per individual, but some people will have it for years. Some people will have it for months, and then suddenly their thyroid hormones will tank. So I check the antibodies because if I see that it's positive, then I know that I need to keep a closer eye on this person's thyroid. And I might go ahead and check that expanded panel to see if their thyroid hormones are actually being affected, because sometimes that may happen before your TSH is affected. So if you have a multitude of symptoms that scream thyroid, then you definitely want to get with your healthcare provider and see if they will order an expanded panel. If they don't, you can see like an outside functional medicine doctor. There also are a lot of lab places where you can actually order your own tests, but still I would find a healthcare provider that knows how to interpret them. Don't put it into Chat GPT. I've had some patients that have done that, and sometimes it's right, sometimes it's not, because everything needs to be individualized. That's what I love about functional and integrative medicine is that it does look at the whole system, because if you have thyroid issues, then the next question, besides trying to treat it and looking for vitamin deficiencies, is there anything else going on in your body that could be affecting your thyroid, such as gut health issues or cardiometabolic issues or immune system if you have the autoimmune form? So there's more to it. And to really delve deep into the blood work, I feel it's justified if you have a lot of symptoms. If you don't, then maybe a TSH is fine. But again, just work with your healthcare provider. And if you have one that doesn't want to work with you, then find another one. More and more providers are wanting to provide a holistic way of treating patients. I hope you found this helpful. Don't forget to follow or subscribe. I'm going to have other videos on thyroid. I'm going to try to get them out this week. My goal is to really provide education and value for you. Thanks for watching or listening if you're listening to the podcast, and have a fantastic day.